The prostate is a walnut-sized gland in men that is part of the reproductive system. The prostate is just below the bladder, in front of the rectum, and the prostate surrounds the urethra. The prostate secretes fluid that protects and nourishes sperms. During ejaculation, the prostate squeezes this fluid into the urethra, and it is expelled with sperm as semen. Prostate cancer is the most common type and the second leading cause of cancer death in men. Around 1 in 9 American men will get prostate cancer in their lifetime, and 1 in 45 will die of this disease. If prostate cancer is caught early, the survival rate is high. So it is very important that you notice changes in your body that might indicate this condition. Today's video will discuss 10 early warning signs of prostate cancer. So let's begin. Number 1. Frequently need to urinate. When the prostate's tumor increases in size, it puts pressure on the bladder and urethra. You may be urged to urinate frequently and sometimes urgently, especially at night. Number 2. Loss of bladder or urine control. Both fecal incontinence and urinary incontinence can come with age. But if you're experiencing bladder leakage or lack of ability to control your bowel movements, it might be a sign that you have prostate cancer. Because if cancer spreads into the bladder and the muscle that controls urination, it makes the muscle weaker and you could leak urine. Number 3. Slow or weak urine. Most men face trouble urinating as they age, and it's usually due to BPH, which is not cancer but does make the prostate grow larger. But sometimes urinary problems, including urinary hesitancy, incomplete bladder emptying, or weak urine stream, are caused by a prostate cancer tumor pressing on the urethra. Number 4. Prostate pain. Pain is more common in men whose cancer has spread to their bones. Cancer can weaken or damage the bones, which may cause pain. According to recent studies, more than 60% of men with advanced prostate cancer will eventually develop bone metastasis. The bones most commonly affected include the spine, hips, and ribs. Number 5. Kidney problem. Kidneys filter blood and remove harmful toxins from the body through urine. Prostate cancer can block the tubes that carry urine from the kidneys to the bladder. This can affect how well your kidneys work, leading to high levels of waste products in your blood and causing sickness, loss of appetite, and swollen ankles and feet. Number 6. Blood in urine. Another warning sign of prostate cancer is the blood in the urine. Hematuria. This can be caused by bleeding from the prostate. Remember that blood in the urine can be a sign of other health issues, including a UTI, urinary tract infection. You must consult your urologist, who can certainly tell the cause of bleeding in the urine. Number 7. Ejaculation issues. Cancer treatment can interfere with ejaculation by damaging the nerves that control the prostate, seminal vesicles, and the opening of the bladder. It can also stop semen from being made in the prostate and seminal vesicles, or cut off the path semen normally takes out of the body. A man can still feel the pleasure of sensation of orgasm, but the difference is that it can happen with little or no semen at all. This situation is referred to as dry orgasm. Number 8. Fatigue. Fatigue is a feeling of extreme tiredness that doesn't go away even after you rest. It is very common in men with advanced prostate cancer. You may feel mentally, physically, and emotionally tired most of the times. Cancer cells use your body's nutrients to grow and advance in your body. When your body lacks these nutrients, you can feel extreme fatigue. Number 9. Lymphoedema. If the prostate cancer spreads to the lymph nodes, it can cause the blockage of the lymphatic system. This condition is called lymphoedema. Your lymphatic system is part of the immune system and helps clear excess fluid from tissues. If it is blocked, the fluids build in your tissues, causing peripheral edema. Number 10. Anemia. Red blood cells carry oxygen to your body's organs and tissues, and anemia happens when the number of healthy blood cells is too low. Anemia can occur when your bone marrow is damaged, either by prostate cancer or by treatments such as chemotherapy, radiotherapy, or hormone therapy. Remember, this video is for educational purposes. We are not giving you medical advice. You should always consult your doctor if you need any professional opinion. Did you find this video helpful? If yes, then make sure to like this video, subscribe to our channel, and hit the bell notification button.